Assalamualaikum warahmatullahi wabarakatuh. To Sadaf and my fellow classmate. My name is Muhammad Syarif Mimi Zamzam. Today I want to present to you about minerals. So basically, minerals has two different type of minerals. Okay, for the first is called major minerals, or we can call macro minerals. And for the second is trace minerals. Trace minerals which can call micro minerals. Okay, for the major minerals is required in amounts greater than 100 mg a day. Okay, for the trace minerals required in the diet in amounts lesser than 100 mg a day. Minerals also can be found in animal foods and plant. Drinking water also can sometimes be a significant source of sodium, magnesium, and fluoride. As you can see in this slide, we can see the minerals in our body. This is based on 154 pounds per person. We can see the major minerals take a major than a trace minerals. Next, major minerals has 7 of type of components, which is sodium, potassium, chloride, calcium, phosphorus, magnesium, and sulfur. For the next slide, we can see in sodium, which the function is we can gain a major caption in extracellular fluid and critical electrolytes, which means the minerals will stabilize and maintain our homeostasis in our body. Next, it will maintain our proper body H2O distribution and our blood pressure. Then, nerve and muscles transmission, control our body acidity, which means control our value of pH level. According to RDA is not provide for sodium. A person need take a minimum of 500 mg per day for the sodium. Sodium will get a severe diarrhea, which means the diarrhea will electrolyte the solution. Is the base for source of sodium replacement. Okay, for the next slide, we can see from where we can provide any source of this sodium. We can gain from the table salt and soy sauce. Next, we can gain from salty or smoked meals and fish. Next, the sodium will make our kidney excrete the excess in our urine. But when you taking too much of sodium and not enough water, we make our body dehydration. Taking salt tablets before or after exercise is not unnecessary for our body, because if we can harmful our body and make our body tired. Hyponatremia and hypernatremia, which these two we can gain if our body lack of sodium and taking too much sodium. Okay, for the hyponatremia is low of blood sodium, which we can gain severe diarrhea, vomiting, or intense prolonged sweating. Okay, for the treatment of the hyponatremia, we can replacement of fluid and mineral through liquids and food or intravenous solution. Okay, if we not treated by the hyponatremia, a person we can gain a headache, confusion, seizure, or maybe the bad thing will gain a coma. Okay, for the hypernatremia, abnormally high sodium in blood due to rapid intake of large amount of sodium. Example, drinking seawater. As the result, we can gain edema or swelling and raise in our blood pressure. Our blood pressure will raise. Usually, hypernatremia can be seen in patients with congestive heart failure or kidney disease. It will also contribute to hypertension and osteoporosis. Osteoporosis is a medical of an individual condition which the bones of a person will become brittle and fragile from loss of tissue. Okay, for the next slide is potassium. The function of potassium. First, it is important component of our muscle contraction. Next is a transmission of nerve impulses. It will helps regulate our blood pressure and maintain our temperature. The RDA for the potassium, a person need a minimum requirement 2000 or 3000 mg per day. Okay, for the major source of this potassium, we can gain from fresh vegetables and fruits, which contains all potatoes, spinach, melons and banana. The disease that we can gain from this potassium if we lack or taking too much of potassium in our body is hypokalemia and hyperkalemia. Hypokalemia is a low blood potassium. It is caused by vomiting, diarrhea or diuretic. The symptom of this hypokalemia can be seen when we have a muscle weakness, loss of appetite and confusion. The high risk people, which is the people with poor diet, alcoholics, anorexia or bulimia nervosa, will gain more the hypokalemia in their body. Okay, for the hypo is the low of the potassium. Okay, for the hyper is the high potassium in our blood. It will excess potassium due to kidney malfunction and remove excess potassium. Okay, for this hyperkalemia, the person with this disease, it will stop their heart. Chloride function is to maintain body fluid balance. The chloride will help kills many diseases that cause bacteria and help prepare protein for enzymatic digestion. White blood cell use chloride ions to form a powerful chemical to kill the bacteria in our body. Okay, for the RDA chloride, a person need to take 3400 mg per day. Sodium and chloride will excess sodium and chloride may aggravate hypertension. Okay, for the source of chloride, we can gain from natural source, which means fruit and vegetables. Other than that, we can gain salt. Hypochloremia, which chloride deficiency due to vomiting. Okay, the risk is anorexia and bulimia. It can cause dehydration and metabolic alkalosis, which means high blood pH. Okay, for the treatment of the hypochloremia is oral or intravenous fluids. Next, the function of calcium. The function of calcium is bone structure, nerve function, blood clotting, muscle contraction, and cellular metabolism. Okay, for the next, calcium regulation of blood is in our blood has vitamin D. Vitamin D will increase apa gila. Regulation of blood calcium. Regulation of blood calcium can begin by vitamin D. The vitamin D will increase our calcium absorption. Okay, for the next, enhancer of calcium absorption, which is stomach acid, vitamin D, lactose, and growth of hormone. Which in this diagram, this slide has a diagram. The diagram will explain about a parathyroid glands, which is the parathyroid glands is located on the back of the thyroid gland. Okay. RDA for this calcium. RDA for this calcium, we as adults from age of 19 to 50 years will need to take 1000 mg per day. Okay, for the adolescent, need more calcium to maximize their peak bone mass and the growth of their body. Okay, for the adults, for the older adults, which means above 51 years, need to take 1200 mg per day. Okay, for the source of this calcium, can gain from non-fat milk, yogurt, ice cream, cheese, spinach, and tofu. Hypocalcemia is the low calcium in blood. This is causes our body will get kidney failure, vitamin D deficiency, which means lack of the vitamin D. Okay, next is hypercalcemia. This is the calcemia in blood is above the normal level. This caused by cancer and overproduction of PTH. Okay, the symptom will get is fatigue, confusion, loss of appetite, and constipation. Phosphorus is a common in many crucial metabolic systems. It is used to activate and deactivate enzyme, an essential component of ATP, the energy source of the cell. Phosphorus is about 85% in our bone. Milk and meat are major sources of dietary phosphorus. RDA for adults is 700 mg per day, increasing 1250 mg for the teens. The diet high in phosphorus and low in calcium can contribute to bone loss. For the second last, the major of the minerals is magnesium. Okay, the function of the magnesium, it will participate in enzyme mediated reaction. It's the essential for ATP production via ETC and glycolysis. Participate in muscle contraction and blood clotting. Okay, for the RDA of the magnesium, for the adults among of 19 to 30 years old, for the man is 400 mg per day. Okay, for the woman is 310 mg per day. Okay, for the adults that among of 31 years to 70 years old, for the men 420 mg per day. Okay, for the woman is 320 mg per day. Okay, for the source of this sodium, we can gain from spinach, potatoes, legumes, tofu, and some type of the seafood. The disease that we can gain from the magnesium is hypomagnesemia. Hypomagnesemia is the deficiency of magnesium in the blood. It occurs with the variety of disease like kidney disease, alcoholism, and urinary drugs. The risk is prolonged diarrhea and alcoholic. Okay, the hypermagnesemia is the abnormal high magnesium in blood. Okay, the symptom we can get is nausea and general weakness. Okay, for the last of the major minerals is sulfur. Sulfur is a component of the amino acid methionine and cysteine, as well as of the vitamins biotin and thiamine. Important in drug detoxification and in maintaining acid-base balance. A diet sufficient in protein contains adequate sulfur.
What's up guys, it's Ideal. Okay, we move on to our next topic in minerals, that is trace minerals. Trace minerals are needed in very small quantities in the human body. They perform many essential functions important to health. Toxic levels can easily be reached with the use of supplements. So, the first mineral in the trace minerals is iron. The function of iron is utilization of energy in cell metabolism. Part of the protein hemoglobin which carries oxygen in the blood. Part of the protein hemoglobin in the muscle which makes oxygen available for muscle contractions. The deficiency of this mineral will lead to anemia, the most common nutrition deficiency worldwide. Deficiency also will lead to vulnerable stages of life. Women in reproductive years due to menstruation, pregnant women due to the illness of the infant, increase in blood volume, and loss of blood during the birthing process. Infants and young children and teenagers due to rapid growth. The symptoms of iron deficiency or anemia is fatigue, craving for ice, sore tongue, headache, brittle nails, overall bodily weakness, rapid resting heart rate, pounding in the ears, pale or yellowish skin. Iron deficiency and pica generally found in women and children from low income groups. Eating ice, clay, paste, and other non-food substances. Eating non-food substances will not correct the deficiency. Iron toxicity. Iron overload. Hemochromatosis is generally a genetic disorder that enhances iron absorption. Iron overload can also be caused by repeated blood transfusions, massive doses of supplemental iron, and rare metabolic disorders. Symptoms of iron overload include apathy, lethargy, and fatigue. Problems include liver tissue damage and infections. Higher risk of diabetes, liver cancer, heart disease, and arthritis. So, the figure next to it is organ that may be affected by iron overload, that is pituitary gland, thyroid, and parathyroid gland, heart and circulation, ovary for female, and testes for male. So next, iron food sources divide by two sources. And the first one is heme, and second one is non-heme sources. For the heme sources, blood better absorbed, such as liver, beef, pork, but don't eat that, and poultry. For the non-hammer sources, less absorbed by the blood. For example, plant and animal derived food such as dried beans, prunes, apricot, and spinach. So extra information for this mineral. If we cooking in iron pots, it will increase iron content of food. Next is vitamin C increases the absorption of these minerals. Best absorbable form is ferrous, Fe++, but ferric, that is Fe++, not well absorbed. The next mineral in trace mineral is selenium. The function of selenium is antioxidant, working primarily as a part of enzyme glutathione peroxidase or GP. GP prevent free radical formation, regulate thyroid hormone. RDA, that is recommended allowance, is recommend for 55 mg per day only, and UL 400. Sources of this mineral is in the seafood, whole grains, vegetables, depending on soil content. The deficiency of this mineral will lead to Cushing disease, cardiomyopathy, that cover the heart area. The toxicity of this mineral will lead to loss and brittleness of hair and nails, skin rash, fatigue, irritability, Noonan syndrome disorder, garlic breath odor. So the next mineral is chromium or Cr. The function of Cr enhance the effect of insulin, lipid and carb metabolism, immune function and growth. RDA for AI adult 19 to 50 years old, only recommended 35 mcg for male and 25 mcg for female. For older adult, only 5 mcg or less. The source of this mineral is mushroom, dark chocolate, prunes, nuts, asparagus, and whole grain. The deficiency of this mineral will decrease insulin mediated glucose uptake by cells, decrease insulin sensitivity, elevated blood glucose, and blood lipid abnormality. Quick quiz. Is it true that selenium recently discovered to be needed by humans? You have 5 seconds. 5, 4, 3, 2, 1. The answer for this quiz is false. The most needed mineral in human body is chromium. So next mineral is zinc. The function of zinc is necessary for energy metabolism, that is necessary component of insulin. Required for the activation of many enzymes, essential fatty acid metabolism. Necessary component of sperm, this one is for male. Necessary for fetal development and growth, and necessary for wound healing. The deficiency of this mineral will lead to growth failure, delay sexual maturation, slow wound healing, loss of taste and appetite, and low birth weight. This is an article that people who have zinc deficiency. Okay, the symptom of zinc deficiency is nausea, vomiting, weakness, and fatigue, and also increased blood lipids. So the deficiency zinc will higher the risk of getting kidney failure and altered immune system. So the zinc food sources is such as animal sources better absorb. For example, shellfish, meat, and all kinds of meat. Other protein foods like milk and cheese, for example, and green and nuts are plant-based food. Next mineral is iodine. Function. The function of iodine is component of thyroid hormone, regulates growth and energy. Deficiency of this mineral will lead to goiter for adults and cretinism for children, and also mental retardation, drug failure, and hearing loss. This diagram shows the thyroid gland enlarged due to iodine deficiency. In Malay, we call it beguk. Iodine toxicity will lead to goiter or similar like symptoms. The sources of iodine, the food sources of iodine is iodized salt, seafood, bread and dairy products, plants grown in iodine-rich soils, animals that feed on plants grown in iodine-rich soils. Next is fluoride. Fluoride roles in the body is formation of teeth and bones, help to make teeth resistant to decay. The deficiency of fluoride will lead to tooth decay. The toxicity of fluoride is mortal teeth fluorosis, irreversible pitting and discoloration of the teeth. Food sources of fluoride is fluoridated water, tea, and seafood. So the diagram shows the food that high in fluoride, such as fluoridated water, grape juice, chicken, sardines, and tea. So this is a picture of tooth decay due to fluoride deficiency. Quick quiz. Toxic discoloration of teeth, not a health problem, more a cosmetic issue. Deficiency, increased susceptibility to dental caries. Children most likely to develop this problem. The answer given is fluoride toxicity deficiency. Is that true or false? So 5 seconds. 5, 4, 3, 2, 1. The answer is true. So that's all from me. Thank you for your attention. Before we end this presentation, I would like to wish to you guys happy Eid Mubarak, and of course to Daniel. And also, before I forget, I want to wish happy Teachers Day to Sir Adam. So thank you. Forget to share, like, and subscribe.